Welcome back to the Mom Life Hack stage. For those of you just tuning in, I'm Carly Silberstein. I'm the CEO of Redstone Agency, an event management company located here in Toronto, executing online, digitally all over the world. And I am pleased to introduce you to our next speaker, Taya Griffin. She is a lactation consultant and will be spending the next 30 minutes with all of us talking about boobies, milk, latch, and so much more. Taya, thanks for being here, and over to you.
Thank you. Thanks for having me, MomFest. I'm super excited to be here. I can't wait to answer all the questions that you have about breastfeeding and your breastfeeding journey. I'll introduce myself. My name is Taya Griffin. So I'm an internationally board certified lactation consultant. I've been in the breastfeeding world for about 13 years now. I studied and worked with Dr. Jack Newman and Edith Kerneman at the now International Breastfeeding Center. It used to be called the Newman Breastfeeding Clinic. And I now work with Dr. Kulik, who you may know, at Kid Crew, which is just at Bathurst in St. Clair. We have a lactation clinic there, and we assist moms with in-person help. I also do in-home lactation visits, yay for phase 3, because for the longest time, we could only be virtual or in the pediatrician's office at Kid Crew. But I also work with well.ca, which is the reason that I'm here today. We do virtual visits. So not many people know that well.ca actually has a complete services arm, and myself and Laura, who's a naturopathic doctor, are here to talk to you on behalf of well.ca. We will, and I'll announce, there's a little code that you can use if you wanted to access an online session for any number of practitioners with well.ca. But I'm here right now to answer any questions that you have around your breastfeeding journey. I really want you to use that chat function to ask the questions, which therefore I can use to direct our talk today. I don't know whether I'm speaking to primarily moms who are already breastfeeding, or if we have some moms who are attending MomFest who are pregnant. I'm hoping there's a variety of both. I always like to open my talks regardless with speaking a little bit about the World Health Organization's statement on breastfeeding. And the reason why I love their statement on breastfeeding is because it highlights how important breastfeeding is for baby, but also how important breastfeeding is for you as a mom. So in their statement, they speak specifically to trying to breastfeed to 6 months exclusively, and then to breastfeed to 2 years and beyond with the introduction of complementary foods in and around the 6-month mark. But it's not just for baby's benefit. It is also for your best health. So even a small amount of breastfeeding is optimal and helps to reduce your risks of breast cancers, ovarian cancers, heart and stroke, rheumatoid arthritis, with good support from an internationally board certified lactation consultant who is working with you to reach your goals. Because of course, your goals are the most important thing to us who are well-trained. Then it also reduces the risk of postpartum depression. So with that in mind, I'm going to look here to see if I have any questions. So this is great. We've got a couple of moms who already have a little one, but are going to be breastfeeding another little one soon. We have someone who's asking a question. Yes, and you know what? It's so tough. I'm actually seeing so many moms right now that we can finally do home visits, that gave birth in the depth of COVID, and unaware that there were programs that extended just beyond their hospital-based program, or maybe a little mistrust of the possibility that a virtual visit can give any source of help. I'm now seeing all of those 4, 5, 6-month-olds whose moms had so little access to support because they were giving birth in a void in the depth of this pandemic. And so I'm seeing so many situations where we're almost having to teach mom and baby to breastfeed because now finally we can see you at home. So mom says that there was some top up that needed to happen. And mom is breastfeeding now, still amazing, baby 7 months, but how many times should we be feeding throughout the day? So if we follow the Leche League and World Health Organization statements, as well as, of course, when we do the research and we look at what our lactation consultant research will show, we still actually want to be feeding baby 8 to 12 times in a 24-hour period, even at the 7-month mark. In fact, we'd want to be doing that well into their, as they get closer to year 1. And then from year 1, we would just simply do it as often as we'd like to. But the vast majority of their diet, per La Leche League, World Health, etc., should be made up of breast milk, with the solids providing the additional nutrients such as the iron, other minerals and vitamins that the breast milk won't quite make up in terms of nutrition. And then, of course, eating is fun. So we want to start at 6 months. We want to give them this opportunity to go to explore food and tastes and textures. But ultimately, we should try to be feeding just as frequently possibly as we did before. Of course, baby will start to have longer sleeps, and there might be a few less feeds, but not that I love the phrase food before 1 is just for fun, because it's about so much else. So that's La Leche League's coined phrase. However, developmentally, babies need to eat food. And for other minerals and vitamins and iron, they need to eat food. But if we try to make the vast majority of their diet with milk, that is very, very helpful. So keep up the good work. Amazing. So for those of you maybe that are pregnant, we will kind of speak a little bit about the World Health and UNICEF's 4 main ways to get breastfeeding off to the best start. Number 1, we want to try to initiate breastfeeding within the first hour. Now, even second-time moms might not be aware of what we call the breast crawl. The breast crawl is this miraculous ability of babies right after birth. And if you just look up, you YouTube breast crawl, and there's a wonderful video put out by UNICEF. There's a few others there as well. And essentially, baby has been practicing these reflexes that allow them to crawl up to the breast throughout the duration of their gestation. And it's the palmar grasp, the stepping reflex, the rooting reflex, and the sucking reflex, among some other more complex reflexes. So that when we give birth to our baby and we place baby on our chest, he or she actually has the ability to bounce, move, guided by, and of course it's a chilly day, guys. I had to wear my boob scarf, of course. Guided by the smell, the touch. It's the reason why our areola and our nipples darken. It's like a bullseye. And baby can actually, if we're in a semi-reclined position, we're not all the way prone or supine, we're not all the way on our backs, we're semi-reclined, to actually come boop, 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 and self-attach. If baby elephants, baby deers, etc., can get up and start to walk, what's to say that we can't have a baby that literally right after birth can move around and find that breast? And what's so interesting is that how well breastfeeding goes within this first hour. I know, I love it. My husband, of course, does not like the scarf. He's like, you're not really going to wear that around, are you? But if we are initiating breastfeeding in this way within the first hour of life, it's actually directly correlated to how long babies go on to breastfeed for. And here's another little tip, a very easy additional intervention right after birth that has been proven to increase the exclusivity as well as the duration of breastfeeding. So that means we have a higher chance of just exclusively breastfeeding, if that's our goal. It's not everybody's, but if that's our goal, and increases the duration of breastfeeding, is to try to delay our infant's first bath. And you will find lots of great research on that too, if you search it out, that if you don't right away bathe a baby and you just give them some days, Now, of course, are you going to want to wipe their bum and clean that up with a cloth? Yes, you are, because that meconium is sticky and thick. But a full submersion in this washing of all of that lovely stuff that we should rub into their skin is just not necessary. And just that one simple intervention of not actually bathing our baby can have a lovely effect. So exclusive breastfeeding can be enhanced via the breast crawl and via delaying infant's bath. So just looking at this question from Laura. Oh, yes. Okay, so Shield. Can I tell you, Laura, this is so topical for me today because I saw 2 babies today. One up at a home visit, a drive up to Woodbridge, baby quite young. Second at Kid Crew in a clinic. At clinic, we also saw a baby on a Nipple Shield. In both cases, moms were told, which I cannot tell you how much this hurts my soul, that they had flat nipples and therefore would have trouble breastfeeding. To make a statement on a mother's nipples is possibly the first indication that a lactation consultant doesn't have the skills to help you, because it's not about your anatomy. It's about the connection of your anatomy to baby's mouth. In both these cases, babies had a tongue tie. So that's the tightness of the base of the tongue to the base of the mouth. There was an underlying issue as to why the Nipple Shield was recommended, but that mom was never alerted to the underlying issue. But in both cases, baby had never, ever latched onto a nipple, a bare nipple, an actual breast. And today, in a straddle latch, which is essentially the latch where a baby comes on from underneath, and they are brought on, it's very handy because I've got 2 of these here now, brought on from underneath with maybe some movement of the jaw, a lot of vigor and some guidance and help. Both babies latched on without the shield. And so really what we want to do is we want to seek out the guidance of someone who is highly skilled to help you to remove the nipple, but at the same time latch baby properly and figure out why it is that baby never latched well at the beginning. Few things with the Nipple Shields I want you to remember is that it's very important to pump after Nipple Shield feeds because generally it lowers the supply, and to try and get baby, to see if baby can latch on without a Nipple Shield as soon as possible. Now, not all hope is not lost if your baby's older. We had a baby come into the clinic at Kid Crew, and mom had taken my prenatal breastfeeding class. So I teach them prenatal breastfeeding classes around the city, Toronto Yoga Mamas, West End Mamas. We used to have them at Kid Crew, and hopefully we'll bring them back in the post-pandemic, whenever that'll be. But we had a mom who had gone to the same breastfeeding clinic. So really make sure, please, if you're getting results that still are painful, still are not seeming to get you where you need to be for your unique breastfeeding journey, please get different help. But this mom had gone 6 times to the same breastfeeding clinic. Finally, we saw her at Kid Crew. There was a posterior tongue tie. This poor mama was not even feeding with the Nipple Shield, because even with the Nipple Shield, there was pain, excruciating pain in the nipple. So she was just pumping and bottle feeding, and this was really her last resort to come and see us. And then when we released the tongue tie, so just clip that tissue back, baby's mouth opened, and mom emailed me, and sometimes as I tell the story, it makes me choke up. A week later, and she said, I left your clinic, and I never used a Nipple Shield and pumped ever again. She said, I went and I exclusively breastfed my baby on a bare breast without any tools. And it was just this dang tongue tie. So if we had seen her 6 weeks prior, we would have been like, there's a tongue tie. Let's release it. Let's never use the shield. Let's never pump. Let's just get your baby breastfeeding. So please get good help if you find that you are still using a shield, because there are different latches that might not ever necessitate any kinds of intervention except better latching. And then, of course, there might be reasons. And sometimes it's not even a tight tongue. It's a jaw tightness, a chomping that baby does because that's how they feel that they need to get the milk out. So we can do suck training. We can do all kinds of things. It's really exciting. How long do you recommend delaying the bath for? Just to kind of go back to that one, I would say you're waiting 3, 4, 5 days. You'll know when it's right. With my first, we gave birth at home, so she was bathed on day 3. And my second was born in the hospital. We had to spend 48 hours there because she had a heart problem. And then we got home and it was like, we're home. And we have got this other kid running around. I think it was maybe day 5, 6 by the time we got to her to give her bath. So there's no rush. You'll know when it feels right. When we did it, we were super nerdy. And we lit some candles in the bathroom, and my husband went in the bath with them, and we just watched. It was really, really cute. But you don't need to go to that extreme. But there's just no rush, essentially. You'll know when you're like, yeah, baby, and I've really got it. We're in this groove. We're in this groove now. Oh, take a deep breath. Yeah, we'll bathe you now. Fiona's asking a question about her son who's 9 weeks old. Congratulations. Gaining well. Lately becomes very squirmy when nursing, bobbing his head and coming off the breast. It could absolutely be gas. However, if you lift them up and you burp them and then try to take them back on, if this behavior persists, you've got to ask yourself a few questions. Is it more pronounced at certain times of the day? Is it more pronounced when he's more awake versus sleepy? And is it more pronounced at certain times during the feed? Because what can happen is that the flow of milk, the spray of milk that a baby may have gotten used to when they were 1 or 2 or 3 weeks old, has now slowed down. And the only way that they can tell you is to get squirmy and to pull and to bang or to arch at the breast. If that's the case, I would suggest meeting with a lactation consultant who can help you to make sure that the latch is great and that feeding management is going well. And by this, I mean that you are watching for drinks, compressing to keep baby drinking, and that you're switching sides frequently. This is all feeding management and can help baby to feel secure at the breast with what they're getting. So it's essentially a latching and feeding management issue. Now, generally we find that these babies are having this behavior later on in the day. When they're sleepy or at night, they're like, I'm chill. I don't care if it's slow. And actually, usually it's faster in the first few feeds of the morning. And often this will generally happen towards the end of a feed. And then I'm less convinced it's gas and more convinced that it's flow and flow preference. If there's any bottle feeding, we need to slow down the bottle as well, because babies, guys, I just told you, they can bob themselves to the breast and self-attach right after birth. They will choose the ease in which they get the milk. And if the bottle comes fast, they're no dummy. They'll say, this breast is slow. Where's the bottle? So if you are giving bottles, if that's part of your mix, we want them to take 20 to 30 minutes and give baby lots of sucking. So a lot of things to unpack there. We have Benita. She had to go on domperidone both times for your baby. So for those of you that aren't sure what domperidone is, it is a medication that is given to breastfeeding moms, which will affect prolactin levels and therefore increase milk supply. Caveat, we only want to take domperidone at the same time that we're getting very good lactation support. In other words, has someone checked your latch? Has someone checked the oral anatomy and baby's body? Do you know about good feeding management, which we just addressed? Because just like herbs, we cannot simply take a medication that increases our supply if baby is still, I'm not getting enough milk out. What do you mean? Because then the milk supply will go down. It won't work. So make sure you're getting really skilled lactation support at the same time. Ooh, mama, triple feeding. So triple feeding, for those of you that don't know, is you feed, you pump, and then you feed with a bottle. That's very, very hard. Both androgenous and still enough milk. Is there an underlying cause for this? I would say my first question would be, have you met with a lactation consultant and have they ruled out underlying issues as to why your baby's not drawing milk out of the breast? So I rarely will recommend triple feeding. Rather, what we would do is we would feed, we would offer a tube at the breast with additional supplementation, and then sometimes we would pump if we weren't using the tube. This would teach baby to trust the breast. This would mean that we were removing milk from the breast at the same time that so it's like a little tube that comes and attaches onto the breast. And then I would suspect, is there something else going on with the lactation? But could there be an underlying cause as to why we might not have enough milk? Sometimes there is. It's very rare, but sometimes there is hormonal issues. There are other health issues. But I would say, for the most part, what I see is an insufficient milk removal at the beginning of lactation, which then leads to the necessity for domperidone or the medication. And then if that hasn't been also really supported with lactation care, then that doesn't do the work it needs to do. I would also like to ask you what dose of domperidone you're on and all of those kinds of things, because sometimes we can increase the dose at the same time that we better our breastfeeding. So hopefully that answered a few of your questions. But it is really, really hard when we are working so hard for our babies and not seeing the results. Jessica asked another nipple shield. I'm telling you, I just feel like hospitals hand these things out like candy. Now, we've had some discussions on our Canadian IBCLC's Facebook groups, and it's, I think, often because they're not sure if they're going to see you again, and so they want to give you a tool to see if you can make it work. As I said, in 13 years, I've never recommended a nipple shield, not one single time. So what are the underlying issues? Flat nipples. I'm not always convinced that there are true flat nipples. I think with good skilled help, it's called breastfeeding for a reason, not nipple feeding. No one would do it if it was called nipple feeding. It would be too sore. And so really we want to get the baby latched a lot onto a lot of breast tissue. And so mom said that, you know, once we learn to latch from the beginning without the shield, it can really, really be, it can be a wonderful experience. So get some help. Yes, and what I would say is that definitely if you seek out good help, we can, and honestly, sometimes sooner than better, we can provide some different suggestions as to the things you did. And so glad that you did the SNS. And moms, I've got to say, everybody will say to me, oh, you know, can you move in? Or wow, things are going so well. And honestly, here's what I know. You're putting in the work. You're doing the work. I am a dance coach, if you will. I am a cheerleader for sure, but you amaze me every day. When I saw these two moms latching their babies for the first time without a nipple shield after weeks and weeks, moms are amazing and you're so resilient. And one mom I saw today had a big gash out of her nipple and had been feeding her baby like this for 4 weeks. She tolerated excruciating pain at every feed for 4 weeks. Baby was chill. Baby's like, I love my life. Look at how much I'm getting. And my mom keeps putting me on, even though I'm chewing on her nipples. But honestly, make sure you get good help because you matter just as much. And I'm amazed by you guys every single day. You're amazing. So my 4-month-old, this is Melanie, my 4-month-old only drinks 3 to 4 minutes at a time in the day, about 9 minutes at night. He doesn't seem hungry, but he does try to put things in his mouth. Well, that's a real tricky one, right? Because at 4 months, they're like, what is this hand that I have? And they're just discovering things. They start putting their feet in their mouth. It's the cutest thing. So I would say that go with your gut. What I also think that as moms, we are not taught to trust and support and really dig deep into is our intuition and our gut. There's so many books that derail our sense of intuition about our babies, that we should do this kind of method and that kind of thing that we should put and there's all these methods. Many of these books, if you look, are written by men who have never breastfed, just as an aside. And so I want you to dig deep and I want you to say, you know what? Maybe I'll put him on the breast. Oh, look, he clearly is not hungry. This guy is an efficient feeder. Obviously, you latched him well. He's worked really hard. If he's gaining weight, peeing and pooing, lovely disposition, great sleep, then amazing, mama. He's probably getting more than enough. Now, if you think, well, maybe, are you hungry? And you put him to the breast and he drinks. Well, the reality is that you will never be able to overfeed a breastfed baby. Also, babies are just like us. Sometimes, like I'm feeling thirsty here. I've just been talking for 25 minutes. I might need a little something to drink. And it might happen on a hot day, or sometimes I need, something more substantial. And so there's nothing wrong with offering it at other times just to see if they can take a little sip. It doesn't derail any other part of the feeds. But I think that, that go with your gut, try, but it seems reasonable if there's at least 8 to 12 feeds in a 24-hour period of that kind of feeding, if it's efficient, and if you can see drink, 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 and baby comes off satisfied, that can be okay. Now, as a caveat, 4-month-olds will sometimes at this point start to say, I'm only going to wait for the letdown, and then I'm going to give up. So you could say, if you don't see good drinking towards the end of those, like at the 3-4 minute mark, say, okay, let's try and take it to the other side. Take to the other side. Nice big compression. Oh, he went to the other side. He's drinking on the other side. Oh, and he's drinking well for 3 to 4 minutes on that side. Then he got a second letdown, got even fuller. Does that mean that he's not going to chew on his hands that he's newly discovered? Maybe. So try. It's an experiment. It's actually, I think it's fun to try and experiment and be a bit of an investigator to see whether you can action various changes with them. They're miraculous babies. So Margaret, 13-month-old, it's so sweet when they get older. Now, I'm not necessarily advocating that we all do this, but for sure, when you're breastfeeding a baby that can talk, it is amazing. So I breastfed my first, might seem crazy, but the natural age of weaning is between 2.5 to 7 years of age. My first fed for 4.5 years and my second for 6. My favorite part about that is what they tell me now the milk tasted like. So they both say it tastes like chocolate vanilla swirl ice cream. And my now 10-year-old says, I will never taste anything that good. I mean, I'm amazing. I make ice cream. So breastfed for 14 weeks exclusively. Had to use the shields. Yes, I know. But they had to go on formula for 2 weeks, trying to pump and restart breastfeeding. Yeah, so that is called relactation. And I've worked with many moms to relactate. I actually just recently worked with a mom to lactate. So her sister is essentially being sent back to India. Her visa's off. Her sister's leaving her 6-month-old baby in Canada. And the sister is lactating, or we're calling induced lactation, so that she can breastfeed her her sister's child. It's amazing. So relactation is absolutely pumping every single time baby needs to feed, making sure, of course, if we're bottle feeding, that then we are supporting the breast milk supply, maybe with medication, that domperidone we talked about. Maybe there's the herbs. The herbs can work pretty well. And then if you wanted to breastfeed baby, then there are some other things that we could try. The lactationator tube at the breast to get baby to trust the breast again. This will also, to be honest, babies are the best pumps. That ultimately a pump can never remove as much as a baby. Caveat, a baby that's well latched. You could say, oh, but my baby doesn't really feed at the breast, but I can pump. It's because your baby can't latch well. So I would say pump. I would say consider speaking to a professional about the medication. And then if you wanted to breastfeed, make sure to get really, really good help. Jackson, yay. Oh my goodness, so many big boys here. A breastfed baby, it is not possible to overfeed an exclusively breastfed baby. There is a hormone in the milk called leptin, and it shuts down their hunger. It says, you're done, baby. You don't need any more. So if you're feeding every 2 hours, then possibly what might be happening is that within the span of a feed, we don't have efficiency. We need to get a deep latch for efficiency. So one of the moms I saw today also said, since I got help from a lactation consultant, a lovely colleague of mine, and then she came to clinic, my feeding has gotten shorter, which was good news to her because she had sore nipples. And so my feeding has gotten shorter and more efficient. That's what we want. And also what that can lead to is less feeds per day. So it's almost as though when babies feed so frequently that they are literally going to the breast, and I think I have to finish soon, but they're going to the breast and having a little bit of their appetizer and a little bit of their main course, and then they're like, I'm okay. And then 2 hours later, they're like, oh, I still want some of my main course, and I want some dessert. Oh, but maybe I want now the beginning of my appetizer, my next meal. Versus sitting them at that table, I call it the restaurant, and it's the restaurant, and getting them their main course, their appetizer, their main course, making them get their dessert, and then you're like, would you like some cheese and some wine after the dessert? And then they're tanked. And when they're tanked, because they've had a good latch and good feeding management, then they're going to not have as frequent feeds. So that is something to, and no, you don't want to space it out. You want to have more efficient feeds within each feed. Hi, Carly. Carly's coming here to kick me off. I just want to let you know, well.ca's special here for those of you that have attended. If you would like to do a virtual session with any of the practitioners, you can use the code MOMSTO20. And if anybody that's attended my session also would like to do a home visit, you can just mention that you were at MomFest, and I'll give you $15 off an initial session. So thank you so much for all of your really, really thoughtful, meaningful questions. I hope that I answered them all. You can reach out to me. My website is tayagriffin.com if you have any other questions. Thanks, mamas, and thanks, Carly.
Thank you. Have a great rest of the day.
Bye, guys.